So we actually think the plaques are similar. We're coming up with a model where the plaques are similar to something that macrophages do in other tissues when they have a stimulus or a threat that they can't defeat. And they form something called a granuloma. So granulomas exist in many tissues of the body. The most famous are actually in the lungs in tuberculosis infections. And what macrophages do in a tuberculosis infection is they form a granuloma around the bacteria by first phagocytosing, by eating the bacteria. And we think that the dense core plaques of Alzheimer's disease are basically granulomas that are formed in the brain. So in terms of the implications of this, in terms of therapy, if the only thing your therapy does is to break up the dense core plaque, right, to lower dense core plaque burden in the brain, and it doesn't address the production of A beta in the first place, then we would predict that that therapy is not going to be a successful therapy. Well, we're looking at some ways to perhaps encourage the microglial phagocytosis of the plaques. So there have been some drugs that are known to ameliorate symptoms in amyloidogenic mouse models of AD. These are drugs called PPAR-gamma activators, and PPAR-gamma is a transcription factor that upregulates the expression quite dramatically of one of the TAM receptors, MER, in microglia. And so this higher level of this phagocytic receptor in microglia is known to be a good thing in the amyloidogenic mouse models. It actually ameliorates the course of their disease. These things have actually been tried in clinical trials and have not been successful. But there are a lot of issues with getting the drug into the brain, with how well it spends, how specifically it works in microglia. So one of the things we're actually quite interested in is therapies that might be directed towards increasing the expression of this one TAM receptor, MER, in microglia during the course of Alzheimer's disease.